Meet Reid Lance Rosenthal, rancher, #1 best-selling award-winning author, and unabashedly, unapologetically on the right side of the outstanding issues of our generation. But don't try to fence him in. Sometimes his positions will surprise you, because Reid is definitely his own man, with his own opinions. You might love him, you might hate him, but you won't be able to stop listening. Step over to the right side with Reid.
This is Reid Lance Rosenthal on the Right Side Radio. Happy Saturday across the Rockies. KGAB AM 650 and the Town Square Network and Easy FM 101 Colorado Springs, northern New Mexico, and the Monster 780 AM Denver. Hello Montana to New Mexico and Nebraska to Utah. I have a special guest for you today. You know, there's been lots and lots and lots and lots of confab, shall we say, whether it's left confab or right confab or, you know, nobody knows what is going on confab on Obamacare. Now, right now, Obamacare is the law of the land. Hopefully that will not be so in the future, but it is now. And, you know, one of the things that we need to do, and I talk to you about this every week, is we need to be informed. Because that only with information can you make decisions, whether they're political or whether they're for your health or the health of your family and the future of your children. And today we're joined by Kimberly Amadeo. She is a really well-known economist. She writes lots of articles. She has been on Fox. She has been on KOA down there in Denver, 850, big KOA, WDUN, KFNN, CCTV, and, you know, just about across the board. By the way, I know she's a really welcome guest on Varney and Company on Fox Business News, and I happen to like him quite a bit. So anyway, welcome to the show, Kimberly.
I'm pleased to be here. Thank you.
You betcha. And listen, we're going to be talking about Obamacare, and you've written some articles, et cetera. I'm going to be posting some with the show, along with some other articles. And here's kind of how I want to structure the show. Number one, I want to talk about kind of the impact of Obamacare on the overall United States, its economy, its people, people's relationship with their government, and then I want to talk about its impact on the health industry, and then I want to talk about its impact on individuals and a family. And finally, I want to talk about some of those things that everybody hears all sorts of rumors about, and maybe you and I can put it to rest for this audience so that they have some facts to go on. And before I start, and I think you'll tell people the same thing, this is a mammoth, hugely complex, I think intentionally, 2,700 plus or minus page bill. There's more than 20,000 pages of regulations that have already been drafted, and they are likely to triple over the next 4 years. Everybody has heard about the problems of its implementation and the waivers and the unions and the whole 9 yards, so it's very complex. So what I want to do today, and if you're agreeable, is kind of stick to the big picture bullet points that people can get so they understand how it affects them. How does that sound for you?
Sure, that sounds great.
All right, so let's talk about the overall, and by the way, folks, I want to let you know that Kimberly is kind of on the fence on Obamacare. She's not anti-Obamacare. She's not pro-Obamacare. She's an economist. She's looking at things dispassionately from her point of view and her extensive training. You all know exactly how I feel, and if you don't, then, you know, you have not had the radio on for the last 3 years. So it's going to be interesting because there'll be some points that we're going to be discussing, and I think we'll be, between the two of us, we'll be able to flesh out some facts that you can rely on. And that's kind of the point of this show. It's not political. This is kind of fact-driven. So overall U.S., Kimberly, in your opinion, how is it going to affect, number one, the United States debt, primary debt and unfunded liabilities? Number two, how is it going to affect business, both large and small? And number three, how is it going to affect the economy, i.e. GDP, productivity, et cetera?
Well, the CBO study said that over time, because of all the taxes and fees that are involved, that Obamacare will actually pay for itself to the tune of $104 billion in the long run. And some of these taxes are not specifically health care related. but because the bill was so wide and sweeping, that's how they summed it up. So that's the answer to your first question. As far as businesses, I think that the biggest burden is on small businesses because it is so complex that, they have enough to do without trying to, figure out Obamacare. On the other hand, I think once it's been implemented, it will actually make things better for small businesses for two reasons. The first is, rather than trying to search around, as you have to now, to find health insurance plans, and if you've ever looked for health insurance for yourself or for a business, it's not easy. The health insurance exchanges will make it easy. You just go to the health insurance exchange. They'll all be listed. You can compare one to the other, and I've been on what they've set up for the exchange already, and I could even tell, for myself, as I'm self-employed, that it would make it easier to find health insurance. And the second thing is, right now, a lot of small businesses don't offer health insurance because it's so complex for their employees, and this puts them at a disadvantage.
By the way, Kimberly, you're breaking up just a tiny bit.
Okay.
So you might want to reposition just a tad.
Sure. Is it better now?
That's good. That's great.
Okay. So secondly, a lot of small businesses can't provide health insurance because it's too expensive or it's too complicated or they're too busy. So they lose out on some of the better employees who go to a larger firm that can offer health insurance. And this is especially true for older workers who, a lot of people select a company or won't leave a company because of health insurance, even though they might be happier at a small company. So I think, it's going to be destructive in the short term because it's confusing and it's new and it's very complicated. In the long term, once people get used to it, and I mean like maybe in 5 years, it might actually be better for small businesses. And then just as a top line, as far as the economy, your third question, I think that it actually, it will probably hurt small businesses in the short term and take away jobs as they try to figure out, either how to avoid the penalty, not pay insurance, and so forth. On the other hand, the headwinds that are driving the economy in this second half of 2013 are so strong. We've had the strongest stock market ever so far this year, that I think that you won't notice, that it hurts it at all. It's just like the payroll tax when the holiday was over in the beginning of the year. Yes, it's hurt the economy, but, it's not like it's going to plunge us back into a recession or anything like that. I think you're going to see a continuation of the slow, steady growth we've had, which is, slower than I'd like to see. I'd rather see 2 to 3% growth, and we're below that. But I think that will continue through the fall and into next year.
All right. Let's take each of those in turn. First of all, so that everybody is familiar with where I stand, I think that Obamacare is devastating to the United States on a social level, on a financial level, on an economic level, and on an individual freedom level. I don't think there's anything redeeming about this bill. I think it is a play for control more than it is any concern about either the United States or its individual citizens, particularly its middle class. So when you say that, down the road, and we talked a little bit about this pre-interview, but down the road, if everything goes according to Hoyle, it's going to save $104 billion a year. To put it in perspective, our deficit this year, if they make their numbers, will be $769 billion. And our deficits over the last 4 years have been between 1.1 and 1.4 trillion. So $104 billion is not a lot of savings, assuming it's achieved. But more importantly, the reason that they say it's going to, quote, unquote, pay for itself is, as you mentioned, taxes, correct?
That's correct.
All right. And taxes come from where?
They come from everybody.
Exactly. So the bottom line...
business taxes come from individuals because the businesses raise their prices. So ultimately, every tax comes out of an individual.
That's exactly right. So the bottom line is that on the government's books, they'll show, according to, and we're going to talk about these numbers a little bit too, $104 billion surplus, who knows when, 5, 6, 7, 8, I think it was the 8th year, 8 years in the future. But in reality, they're getting to that by taking money out of people's pockets and out of the pockets of businesses, who in turn will additionally charge consumers who are already being taxed for higher prices of goods and services. So the bottom line is that it's sucking money, investment capital, out of the economy to try and balance itself at the government level, and it's balancing itself piggyback on the backs of the average consumer and taxpayer. I mean, there is no other source of money but your pocket and your property.
Sure. I mean, all government taxation and spending is redistribution of wealth from somebody to somebody else.
Correct. But when money is taken out of the pocket of a business, or it's taken out of the pocket of an individual, A, the individual can't invest, can't buy, and B, the business can't invest, can't hire, can't grow.
Right. But the thing is, and part of this, I'm sure you'll disagree with, but I'm going to say it anyway.
Sure.
Is that a lot of what the taxes is coming from people who make $200,000 or more. The capital gains tax is going to increase, and the income tax above the $200,000 is going to increase. And the thinking is that people who make that much money, they don't spend it all. They take a lot of it and they save it and they invest it, which is great for the stock market and it's great for money managers, but not so good for the average store. Whereas people on the low-income side, people who, on Medicaid, people who are below the 400% of the poverty level, which are the people who are going to get subsidies, they don't save as much and they don't invest hardly anything. So all the money that they spend goes directly back into the economy. I mean, this is the reason why they have unemployment benefits, is that they want to redistribute the wealth from the people who save and invest it to people who actually spend it because they have to, and this will boost economic growth.
Redistribution of wealth boosts economic growth?
Mm-hmm, because instead of the money going into investments, such as the stock market, which is not counted as part of economic growth, for example, it goes directly into stores. It goes to grocery stores. It goes to paying the bus fare. It goes to medical costs.
Well, yeah, but look, there are 21 new taxes in Obamacare, correct?
I don't know exactly how many, but yeah.
Okay, well, folks, listen, I did a complete show on all the taxes in Obamacare, how much each raised, and who gets taxed. You guys can go back in the archives on therightsideradio.com. I have all the sites, etc., and listen to that. But, Kimberly, I'm not leading you astray. There's 21 new taxes in Obamacare. 13 of them, $480 billion of the $675 billion in new taxes, fall on people making less than $200,000 a year, and half of the 13 fall on people making less than $50,000 a year. Now, assuming what I say is true, just take it as true. Would your opinion change as to its effect on economic growth for the United States?
Well, I'd have to look and see exactly how much those taxes were. So that
$480 billion to people under $200,000.
And then how's that compared to the total amount that goes to the people making more than $200,000?
The people making more than $200,000 are kind of solely responsible for $195 billion.
Okay. Yeah, I'd have to look at that and really get into it before I could form an opinion.
Okay, it's something I think that needs probably to be put into the equation. Also, you were talking about it's going to be easier for small business because of the exchanges. Now, there's a number of states who are not setting up exchanges, which I happen to agree with. All the exchanges have been delayed because they can't get their act together there at Health and Human Services. And why do you think, I'm a small businessman. I have employees. I have never, ever had a problem finding health insurance for them. It's great health. It's Blue Cross. Have had no complaints. What makes you think that the exchanges, dealing with the government rather than dealing with a private entity, is going to be easier than? I'm sorry, I'm lost on that.
Oh, because I think that it's easier to compare all the different plans, on one site, which is what they have, and what they'll do is they lay it out so that you can compare all the benefits, all the co-payments, all the deductibles, all the lifetime limits, and all the actual things that are, services that are being provided, one against another. So it's all right there, as opposed to having to, find, because the way it's set up now, if you can get Blue Cross Blue Shield, that's fabulous. But if you want to get Blue Cross Blue Shield compared to the 3 or 4 other insurances that are there, you have to, find a broker that you like, and then you have to have him present it to you, and, can you trust them, can you not trust them? Whereas this way, you could just go on there and see for yourself. But you can trust the government?
Well,
you can trust.
You can trust the Benghazi government, the IRS government, the NSA government. We can trust them.
Well, you can trust what's on the website, and actually, you can compare what's on the site from one thing to another.
I must admit that if the President of the United States stood up and told me the sun was shining, I would look outside. That's how little trust I have.
Well, that's okay.
So, we're just going to have to disagree. We're going to have to agree to disagree on this, because the exchanges, one of the things which is not in Obamacare that should be, and at the end of the show, we're going to talk about, how this could have been done really a hell of a lot better, a lot more simply, benefited a lot more people with a lot less cost. And you and I can play back and forth with some ideas. But, one of the things that has not been accomplished in Obamacare's 2,700 pages is that you can't sell insurance across state lines. In other words,
right.
They've limited the competition within the marketplace, which, of course, we both agree tends not to drive down prices, quite the contrary. So if you go to the exchange in California, by the way, 4 insurance companies in the last 2 weeks have withdrawn from the exchange: Humana, Aetna, Blue Cross, and one other, I forget their name. So now they're down to 3 companies. So there is, the amount of competition that's available through the exchanges is limited, right? Because the more insurance companies you have, the more competition you have.
Mm-hmm.
So, there's some problems with the exchanges, assuming they ever get them set up. The third thing that we talked about was kind of the headwinds of the economy.
Mm-hmm.
And, we're going to have to disagree a little bit on this, too, and I will bow to the Economist. But I will tell you from my vantage point, and I seek out many, many, many different sources, and they're not left or right, they're government sites. When we have real unemployment of 14.3%, which is U6, Department of Labor, when we have minority unemployment at over 20, youth unemployment at over 25, when we have GDP that's been revised downwards the last 3 quarters, including one quarter at 0.1%, another quarter to 1.7%, we have real GDP, if averaged over the last 4 quarters, of about 1.6%. I don't call that growth, particularly if inflation, another government statistic, at 3.2% CPI, which is understated by 8%, and I will refer people to realstatistics.com, 1.6% growth is 9% negative growth after inflation. So, the fact that the stock market is rocking and rolling, and we agree, you and I agree on that, and people are making some money, and God bless them, make it and salt it away. But the stock market, don't you think, is not so much a reflection right now of people's ebullience over Obamacare and some of the other policies. But it is a reflection of $85 billion of money being printed out of thin air by QE3. I mean, it's really kind of they're putting hot air in the balloon, don't you think?
I don't, honestly, I don't think the Fed is that powerful. I don't think the Fed, and I know a lot of these, news sites believe that the Fed is driving the stock market growth. I don't think the Fed is that powerful. Once again, I think government can guide the economy, but it can't actually create it can destroy it, unfortunately, but it can't create growth. It could just guide it. But the growth that's already there is based on earnings. And so companies, they're doing well. They're not doing well so much with the top line, but they're doing well, unfortunately, with, cutting costs and creating earnings.
Right.
And so, the stock market in the long run is based on earnings. The second thing is there's a lot of money on the sidelines. That money was in gold. Gold's gone down, and I don't think we're going to see it go back up for a couple of years. And I think it's got much further to go down than it already has if you look at historical perspective. But, that money is now in the stock market, but it's also in housing. And that, to me, is why I say that the economy is moving forward, because we didn't have housing growth. We haven't had it since 2006. And now we have it. And for most Americans, and again, I think of, when I think of my readers and the people I talk to, I think of my sister, or, who's a nurse, actually in Colorado, by the way. So shout out to Marcy.
Hi, Marcy.
But, who she's far too busy to be analyzing the economy every day like you and I do. And so I want to make things clear and understandable for people like her. And, for people like her, if your housing value is going up, you are going to feel good and you're going to feel confident about the economy, regardless of what the stock market does, because most people, they look at their what they've got in their portfolio twice a year, maybe once a month, but usually they're just too busy. So to get back to Obamacare, whether it's good, whether it's bad, whether it's evil, whether it's fabulous, saintly, I don't really get into that too much, because most of the people that I talk to and that I write to don't get into that either. What I want people to know is whether you like it, whether you hate it, it's coming October 1st. If you don't you need to look at it and see if the government...
Well, you mean it's coming October 1st except for all those folks who have waivers?
Well, yeah. But for most people who don't have waivers, it's still coming.
Yeah.
Most of the people I know, it's coming. And for those people,
right now the estimate is that of the Obamacare market, let's call it, approximately 27% of the market now has waivers. That's a huge percentage. And if they're looking at funding this thing because of participation, along with taxes, and participation rates are driven down by waivers given mostly for political circumstances. I'm sure you and I agree on that. The end, 2 plus 2 just never equals 5. It only equals 4.
I don't know much about the waivers. It depends on who they're. Can you tell me who they're being given to and what they're?
Well, yeah, large businesses over 50 employers got a complete 1-year waiver. Mm-hmm. Unions have a temporary waiver on about 7 of the 12 major aspects of Obamacare until 2018. And by the way, they're already screaming bloody murder about the whole bill itself. Listen, as a funny side note, Congress and the White House just gave themselves a waiver. Now they're only a tiny percentage, but it kind of tells you what they think of the bill.
I understand that they have to sign up on the exchange, but they're still getting. They're getting the same subsidies that they've always gotten. But they still have to go.
The subsidies have been changed to 75% for congressional staffers, Congress, Senate, the administration staff. Oh no, it is good for thee, but not good for we.
But at least they still have to go. They still have to go to the exchanges.
Right. So, I guess what I'm trying to say is, you and I differ a little bit on the headwinds of the economy. You know, you were talking about housing. You and I agree 100%. If your house is solid, you're not underwater on your mortgage, its value is increasing, that is a huge percentage of the typical American or American family's sense of economic well-being.
Right.
Not to mention getting their paycheck and all that stuff, but it's a big deal. However, if you dig into the numbers of the last 6 months, you know, housing went through this wonderful little, I'll call it a bubble. You'll call it headwinds, I'll call it a bubble.
Well, the bubble in 2006 or the one we're in now.
Well, yeah, but I mean, listen, the bubble of 2006, 2007, and 2008 can be tracked right back to government. That's one of the things that scares me to death about Obamacare. If they can take a housing situation, they can determine that they want to redistribute. We've already agreed Obamacare is a redistribution of wealth.
Well,
if they can take a housing situation using the Community Reinvestment Act that Carter put in place, Clinton amended twice, Barack Obama was engaged in the Citicorp lawsuit back in 1988. If they can take that attempted redistribution of wealth through mortgages, 5.5 million subprime mortgages, and they can create the colossal mess that they did, which, by the way, private industry like Wall Street ran with the ball. The money was available. They saw a way to double it, triple it, quadruple it, and off they went. But it started with government. You know, nothing good comes from government's fingers in the economic pie. And the housing deal is absolutely a perfect example. And in the last 6 months, we've heard lots of hype about housing, and we're talking about it now, and prices have gone up in some markets 12 to 20%. Other markets have stabilized at 5 to 7%. There's still a few markets that are lagging. There's a lot more buyers. There's a lot more transactions. Foreclosures are at a low for now. But the bottom line is, if you look at the last 2 months of stats, building permits are way down. Resale of homes is down. The rate of increase of appreciation, which once again is coming off the bottom. A lot of markets, even though they're coming back 12% a year, which is very strong, are not back to where they were in 07, 08. And additionally, probably more importantly, should we say that the housing, you know, you were talking about stocks, and you appear to think stocks are more of a bellwether than I do. And that's just an honest difference of opinion. But taking your point of view, if you look at housing stocks over the past 6 weeks, they have been slaughtered, hammered, from Pulte to MDC and on ad infinitum. So if we're taking what you say, which is the stock market is a bellwether, then this does not portend smooth seas ahead for housing. And my point is to bring it back to Obamacare, because it's all tight info. I want you to understand, we're not digressing, because Obamacare, as Kimberly told you, is huge, complex. It will affect everybody, and it will affect all aspects of the economy. And to understand what its impact may be, whatever your opinion is, you know, Kimberly's is slightly different than mine, et cetera, and we could find 10 other people who disagree with the two of us. But to understand what the impact is, you got to understand where you're at, because you got to start with a baseline. So my opinion, Kimberly, is that we are in a perilous economic situation that's being masked over by the media. It's being masked over by trumped-up figures from the government, unless you really dig. For instance, you know, everybody talks about the 7.4% unemployment rate. The real unemployment rate is 14.3%, and that is right off the Department of Labor stats. But they don't talk about that. So, and by the way, that's 3% higher than Italy. And I think everybody who's listened to this show, you can go back in the archives, listen to my shows on Europe 2 years ago before they cratered. They are part of the PIGS, Portugal, Italy, Greece, and Spain. when we have an economy which is struggling 3% behind Italy's, I don't know about you, but that's a cause of concern for me. I mean, what's next? Are we going to be 3% behind Zimbabwe? In any event, great first part of the discussion. We're going to take a station break here. Folks, this is Reid Lance Rosenthal. I better give you my name first, although most of you know it, even those of you who listen to me because you hate to listen to me. KGAB AM 650 in the Town Square Network and Easy 101 Colorado Springs and 780 AM The Monster out of Denver. We'll be right back with Kimberly Amadeo in our really in-depth discussion of the economy, Obamacare, you, and where it's all headed.
350,000 readers made the Threads West, an American Saga series, a #1 bestseller in 2011, winning 8 national awards, including Best Western, Best Romance, and Best Historical Fiction. Threads West, an American Saga, a 16-book series. This is our story. Author Reid Lance Rosenthal is a fourth-generation land and cattleman whose cowboy heart and poet's pen capture the spirit of the American landscape. His long-standing devotion to wild and remote places and to the people both past and present who leave their legend and footprint upon America and the American West is the inspiration for all of his writing. Threads West, the first of the series, is available at all major bookstores, BarnesandNoble.com and Amazon.com. That's www.threadswestseries.com.
Howdy, folks. Reid Lance Rosenthal on the right side and Kimberly Amadeo, a noted economist, a frequent guest on Fox News, all sorts of radio stations, TV stations, writes all sorts of articles, and we're talking about Obamacare and the economy and you. And we talked about kind of its impact on the overall U.S. economy here at the beginning. We have some agreement, some disagreement. You guys sort out the facts. Now we're going to spend a few minutes and we're going to talk a little bit about what the impact might be on the health industry. And Kimberly and I have talked pre-interview. Neither of us professes to be an expert on this, so we're both coming at it from our particular set of facts and vantage points. So, Kimberly, how do you think Obamacare is going to affect, let's say, Marcy as a nurse? How about the hospital or the clinic, I don't know where she works, the hospital or clinic that she works at? And how is it going to affect the doctors that are out there, both the doctors who are affiliated with hospitals and the doctors who are, sole practitioners, or they're in a group of doctors and have a doctor partnership, I'll call it. What do you think is going to happen with all that?
Like everyone out there, I know people that are in the healthcare industry, in addition to my sister, and one of the things that I found out is that all the doctors are scrambling because Obamacare is forcing them to they're going to pay Medicare, and Medicare sets the standard for all insurance, is going to pay them based on patient care outcome as opposed to tests and so forth. And even already I've noticed that doctors are prescribing less tests, they're prescribing less medication, and it's put an additional burden on them so that, like small businesses, like everyone else, Obamacare is making life more difficult and more expensive for businesses. But I believe in the long run, when this works out, that it will become less expensive and less of a burden as patient focus shifts to preventative care and shifts to the outcome. And that's one of the reasons I think Obamacare will lower health care costs in the long run, because you have people now who don't have insurance. They can't go to the doctor. They won't go, or they can't afford it, and they wind up in the emergency room for situations that could have been treated earlier, such as diabetes or heart disease, if it had been treated sooner. And Obamacare does pay for all preventative types of visits and tests for free. So the person
we've talked about that. It's not free.
Well, it doesn't cost like a low-income person, right? It's spread out. We all share it.
Ain't no free ride out there. All right.
But if you don't have insurance and you have to go to the doctor and it costs you $100 just to see the doctor, and then if he prescribes 2 or 3 tests, that's another $300, $400, and you don't have it, if you have to choose between that and paying your rent, you're not going to go. Whereas
you know what? You and I agree on that. However, if you go to the Internal Revenue Service study of about 4 months ago, and folks, you go back on the archives, I did a whole show on it. They're saying that 30-plus million people will not be covered no matter what, with Obamacare or without Obamacare. Obamacare will add about 30 million people to the insurance rolls, but there are 30 million people out there, and who knows what's going to happen with amnesty. 30 million people right now that will not be covered. So we still have that overhang of 30 million people who are going to be going to the emergency room. And I've looked at a lot of different studies. A bunch of doctor friends of mine have sent them to me. The AMA has done them themselves, or you got to dig into their website to find them because they like to bury them. But right now we're about 68,000 doctors short in the United States. This is, when I say short, that means you walk into it, you can get an appointment more or less when you need it. You can walk into the doctor's office, not wait more than a half an hour, and the doctor can spend quality time with you, or his health assistants can spend quality time with you, and he can do the finish up. And, you get good health care on a timely manner without a long wait.
But that's disappeared in this country years ago. That was gone 5 years ago, and that's because of health insurance itself, which pays for each visit. I mean, I have a friend who became a doctor, and she said, I would not recommend, and she became a doctor at the age of 45, and she's a very successful doctor today. But she said, I would not recommend that someone become a doctor today because you can't make money from it. But that's from the way the insurance companies pay, which is per visit. And
but it's not just the insurance companies, right? It's a decreasing refund from Medicare.
Well, that's true.
Bottom line is they're paying less and less for services from Medicare, and now if a doctor takes a Medicare or Medicaid client, it's unlikely they can make any money on that visitor treatment because of the low reimbursement rate.
Right, and here's the thing, because Medicare sets the standard for all the other insurance. Right. So what's happened is that they're trying to cut the cost of Medicare because, as you know, I'm sure better than I do, if you look at Medicare's cost out through the future as it, as is, it's absolutely unsustainable. It doesn't even sustain itself now. Why they came up with the idea of Medicare in the first place, I'm sure it was great intentions, but it's, absolutely unsustainable.
Well, I'm sure it was the same reason they came up with Obamacare.
But Obamacare is to try to cut the cost of Medicare. It's kind of like taking an anti-nausea drug for, your diabetes drug. You just try to fix it and make it worse.
Do you agree with me that cutting Medicare is a fait accompli under Obamacare, because $715 billion was cut out of Medicare for the initial funding of Obamacare implementation. Do you agree with that?
Well, I don't actually. I looked at that, and it didn't come out that way to me. When I remember reading the study, and I said, well, you could look at it that way. I don't think it was
Well, there's $715 billion less to fund Medicare, and there's $715 billion more to fund Obamacare. Obamacare, do you agree that Obama promised us $940 billion in costs in Obamacare when it was getting passed?
In savings, right.
Right. And you and I talked before the show. We agree that it's not less than $1.7 trillion instead.
That's the actual cost, right? It's not offset.
And if you go to the CBO study and include the year 2022, which has $265 billion a year beginning in 2022, annualized forward, it's actually $2.7 trillion over 10 years. This is against a promise from our administration and our illustrious leaders in Congress that it was going to cost $940 billion to begin with. So it's either doubled or tripled, whatever context you want to look at.
Depending on which study you look at.
The original Obamacare bill had about I'm rounding numbers, folks, had about $1.2 trillion in funding because they figured they might be over in a few places, and et cetera, et cetera, et cetera. Well, as we have just discussed, they're over by way more than a little bit in a number of places. But to fund that $1.2 trillion, and I don't think most people understand this, there were two sources. Number one was the $675 billion in new taxes. We discussed that at the beginning of the show. They were supposedly, remember the president saying, read my lips, read my lips. Actually, that was George Bush. What Obama said was, not one dime will you pay if you make under $250,000. But 13 of those taxes, or $480 billion, are levied on people making less than $200,000 a year. That $675 billion in taxes, coupled with the $715 billion slice and cut in Medicare, is what equaled the 1.2 plus or minus trillion in initial projected funding costs for Obamacare. That is how they got the math. Mm-hmm. And now it's not enough. I mean, no matter how you slice the pie, and, you know, you can hear there's a difference of opinion here between Kimberly and I, but no matter how you slice the pie, 2 plus 2 is 4, and a $1.7 trillion cost, or a $2.7 trillion cost, whatever numbers you want to use, they're all from the government, does not get paid by $1.2 trillion in revenue. So somewhere, $500 billion, if the costs are $1.7 trillion, or $1.5 trillion if the costs are $2.7 trillion, it's going to have to come from somewhere. And my guess is, and I'm just going on what the government has done so far, they will further cut Medicare, and they will further raise taxes. And Medicare, would you agree, Kimberly, that Medicare helps, number one, the lower income folks, and number two, the older folks, most?
Well, since so many older folks are lower income, yes.
Okay,
you know,
so I mean, we're in complete agreement on that, and you know, which kind of brings us to another thing that we talked about a little bit at the beginning of the show, or not the beginning of the show, but pre-show, and that's the IPAB, the independent board. It's not staffed with professionals. It's staffed with government-appointed bureaucrats. And I don't think people really understand what this IPAB is. So why don't you, if you could, tell the audience a little bit about what your understanding about IPAB is. I'll throw in my 2 cents, and I think maybe we can clear up what Sarah Palin calls the death panels, what other people say don't exist, and people can understand that IPAB, A, exists, and B, what its power is.
Yeah, you know, I cover more of the economics of it, so I'm sorry that I'm not going to be able, I don't really know.
Well, IPAB is a 15-member board. Yeah, IPAB is a 15-member board. It's appointed by it's bureaucrats appointed by bureaucrats, and they will dictate whether or not treatments are acceptable. They will dictate, number one, a median level of treatment for ages, productivity, you name it. It's really kind of a form of eugenics, in my opinion, but that's my opinion. What they will do, and this is a fact, is they will be able to say yay or nay to certain types of treatment for certain types of genders, certain types of age groups, and certain types of income levels and productivity levels for people. It is very similar to the board that was instituted in Great Britain, and that's the Medical Advisory Review Board over there, but it's the same animal. So the IPAB, to try and cut costs, will limit treatment. You know, in the end, would you agree, Kimberly, that if you have an insurance card, let's say you're Joe Blow or Sally Lou, you've never had health insurance before. You now go through the exchanges. Everything's working beautifully for you, and you get your insurance through Obamacare. And you got your insurance card. Would you agree with me that insurance card's not going to cure you?
Well, it depends on how you use it. So,
well, but that gets to my point. I mean, If the doctors are not available or the procedures are not approved, that insurance card isn't worth squat, is it?
Well, my understanding about the doctors is that now what they're doing is they're using a lot more physicians, assistants, and nurses and things like that to fill in what the doctors used to do, so that if you still want a doctor, you can get one if you're willing to wait. But otherwise, you can go to the physician's assistant. And the other thing that's come up from this is now there's a lot of urgent care. You have CVS, you have Walgreens that allow, you can go in and just most of what doctors treat are colds, flus, and just,
Sure.
basic symptoms. And you can go in and get that for a much lower cost. So, yeah, doctor shortage is a bad thing, but on the other hand, the industry is coping to deal with it. And I think the industry is going to cope to deal with Obamacare, too. I mean, businesses can plan for anything as long as they know what it is. And the problem that we've had with Obamacare, and this is why I mentioned the death panels earlier, is because there's not only is it confusing to start with, not only is it huge to start with, but then there's all this misinformation that's gone out that confuses people and frightens them even more. And it's frightening enough to start with. And as far as the death panels, my understanding is, it's not so much that they're going to say yay or nay, you live, you die, but it's similar to what health insurance companies do now, which is they're already second-guessing the doctors and saying, well, this is approved, this isn't approved. So, in a sense, that's already been underway.
Yeah, but the difference is this. The difference is that if they disapprove a procedure, the doctor may not perform it whether or not you are willing to pay for it. If an insurance company disapproves a procedure, we think you need one heart stent, not two. And you say, you know what? My doctor said I need two, and I'm going to get two, and I'll just pay him for the extra one. You can go do that right now. You cannot do that under Obamacare.
That's great if you can. That's great if you can afford it. But let's keep in mind that medical care costs are the number one cost of bankruptcy in this country. I mean, more than housing, mortgages, foreclosures, more than credit card. It's medical care costs, and that's even people who have insurance. They don't realize that their deductible was $10,000, or that the copay of 20% of a hospital visit. I mean, it's forcing people into bankruptcy. So let's keep in mind that, if you can pay for that extra stent, that's fabulous. If you can go to another country and get it for half the price, that's terrific. But most people can't. Most people, by the time they turn 60, they 65, they saved up $60,000 in their entire life. That's not enough to retire, much less pay for medical costs. So you and I agree 100%. But either you don't get under Obamacare, either you don't get the treatment because the IPAB, a review board of 15 appointed bureaucrats, has decided that it's not cost-effective for people in this age group to get this treatment. A new hip, a new knee, if you're 70 years old, whatever it happens to be. We don't know what those guidelines are going to be yet. I dread to see them. But, the bottom line is that it is based on a form of eugenics. The more productive members of society get the highest quality care. The less productive, the older set, who also happens to be, and I'll just throw this out for the audience to think about, who just happens to be the more conservative segment of the population and standing in the way of many of the policies of the progressives, they will not get the same amount of care. And I think you've seen that with the cut in Medicare. The $715 billion cut in Medicare, which basically wipes out Medicare Advantage, which lots of oldsters really liked, it's the tip of the iceberg of what's coming. So, the limited resources, both doctors and medical professionals, medical facilities, and medical funding, is going to be directed at certain segments of the population. They, by the way, are going to have to wait in line because of the shortage of medical professionals. But the rest of the population, the quote-unquote less productive, based on somebody's subjective view, or should we say the most loud-mouthed,
based on somebody's political view, are not going to get the treatment that they deserve, number one. And number two, they're not going to be allowed the treatment even if they can afford to pay for it. That, to me, is kind of a scary interjection of government in private decision-making.
Well, and you raise what's more of an ethical point, and it's kind of an ethical point that conflicts with an economic point, because the sad truth is 80% of our nation's healthcare costs arise from the first, I believe it was the first 10 days of life and the last 10 days of life. You know, it's the exorbitant cost of you know, babies that are born too early, and then, you know, trying to keep our loved ones alive with us and any chance of life as long as possible.
Absolutely. You know, this is a bunch
when you're
of tough,
faced with that decision, boy, that's a decision that's very hard to face. But the other side of the coin,
it is a tough decision, a tough dilemma, and, you know, it's the inexorable circle of life. We will all face it. As parents, we will face it as children. You know, it is just part of the cycle. That doesn't make it any easier. Let me ask you a question. You know, we were promised, and the exact quote was, if you like your health insurance, you can keep it. If you like your doctor, you don't have to change.
Right.
What has your research shown on those two promises?
Well, here's the thing. You can keep it, even if you have no matter what health insurance you have, you can keep it. But here's the rub. You can go onto the exchange, and here's the thing. All insurance plans that are on the exchange, and actually all insurance plans that are offered, are supposed to have at least one service in each of the 10 categories of essential health benefits. So many, I can't remember the statistic, but most insurance plans do not meet that standard. They might not have the preventative services, or they might not have the newborn baby services, or they might not have the mental health services. So most of the people will look at their insurance, you know, see if what it has, go on the exchange, and they'll find that they could probably get a better plan on the exchange for less money. So you can keep your insurance, but you probably won't want to. That's one point. The second point is a lot of businesses are going to look at, well, I can either get the insurance that has more benefits to it to meet the standard, or it'd probably be cheaper for me to pay the tax and let my employees go onto the exchange. And the estimate is that there's going to be millions of people, I think it's 3 to 6 million people, who are going to lose their health insurance. Actually,
it was an IRS study. It was 7 to 9 by the year 2020. 7 to 9 million lose their policy.
Yeah, they're going to lose it through no fault of their own, because their businesses will say it's cheaper for me to pay the tax than to keep my insurance.
Right.
But for most people, they will be able to keep their, you know, they'll keep their insurance, but they may not want to. And here's the other thing to keep in mind, and this is something I like to remind my readers. Health insurance is not, like you say, a card that makes you well. Health insurance is supposed to be like any other kind of insurance. It protects your assets from catastrophic loss. And I think we have lost sight of that. You know, so people on Medicaid or even Medicare, I mean, God loves the whole thing. I'm not saying anybody should die in the United States in this day and age from a preventable health disease. But when you look at it, it's like, why do they even have health insurance? Because they don't have assets to protect. You know, it's kind of like we've taken the whole idea of health insurance, which is an economic proposition, and put it into a whole different arena about standard of living. And I could get into a long discussion with you about the American dream and how that's changed over the last 20 years. You know, to say that we need to have a standard of living, that means you're supposed to have health care. And that's not the American dream. The American dream is about opportunity. It's not about guarantees. But to get back to health insurance, you know, so you will be able to get keep your insurance, but let's say you have catastrophic, which again is to pay for that, you know, going to the hospital or getting cancer to protect your assets. under Obamacare, there is no more catastrophic health insurance. So if you have it, you might want to keep it. But if you don't keep it, if you go on to the Obamacare plan, you won't be able to go back to catastrophic.
Right.
So I think that's a little unfair.
Yeah, I agree. Listen, we have, I can't believe it, we have almost consumed an hour here. I think we both agree this topic you could probably spend 2 days on.
My gosh.
But as a final question to you, before we wrap up, do you think, never mind the fact Obamacare is passed and it's the law of the land and who knows if it'll be repealed and all that stuff, all the ifs, ands, whats, maybes, is. As an economist, do you think that there was and is a better way to accomplish some of the goals that we've both talked about, ensuring as many people as possible, for the least cost as possible, with the least effect on the economy as possible, with the least government, should we say, interference or interjection as possible? I mean, wasn't there a better way to do this?
Well, here's what's interesting about that question. If you look back in history, you ask yourself, why do we have Obamacare? Well, we have Obamacare because we have to provide, we're making it a private health insurance based on private health insurance as opposed to government. It's not universal health care like Canada has, based on private health insurance. Well, why is that? Because back in the 1940s, they had wage price control, and after World War II to prevent inflation, but they allowed businesses to provide health care, health insurance, as a non-taxable benefit. So that little decision way back then has, over time, created Obamacare as we know it today. So is there a better way to, so it gets back to, well, is there a better way to what? It depends on what your point is. What is the point? Is the point to lower, Obamacare is supposed to be a solution for Medicare because Medicare costs are out of control. But you could go back to a country if you're going to start from scratch and say, okay, let's sit down and talk this over. Do we feel that as a country we want everybody, as we're designing this country, should we all agree that no child should go to bed hungry in this country of ours? Do we agree that no one should die on the street from certain diseases? Do we agree that old people should be kept alive as long as conceivably possible, whether they want to or not? Do we agree that, it's like we'd have to start from that point to say what kind of country do we want, what kind of shared values do we have, before you could even begin to design a health care program, whether it, and I guess, and this sounds very harsh, but it kind of puts a perspective on things, and I'm not saying I have the answer, but either everybody should have health insurance or nobody should have it. It depends on what kind of country you want to have as to, how the people in the country want to provide, services for that country. So I think that gets back to the American dream discussion.
Yeah, and you know what? I'm going to have you on, and we're going to talk about that American dream because that's a fascinating topic, and it ties into everything we've talked about today, the economy, Obamacare, you name it. It's been great to have you on, Kimberly. Thank you very much for your time. We're going to have you back here in the next month or two, and I hope, folks, that between the discussion between Kimberly and I and two varying viewpoints in some sectors of this huge discussion, that you were able to siphon out some facts rather than the hoopla that's out there from the left and the right, so that you can make some decisions and some determinations for yourself. But one way or the other, you can't sit on the fence. You have to, if you are adamantly opposed to Obamacare, you need to get involved and try and get it defunded and repealed. If you are adamantly for Obamacare, you need to understand what it is, what impact it will have on your life, and you need to get behind those forces that want to implement it. We are past the time in this country on this issue and many others for fence sitters. It's time to think. It's time to act. This is Reid Lance Rosenthal on the Right Side Radio. Happy Saturday. Till next Saturday. Stay healthy. Stay wealthy. Stay wise.